Risk stratification of diabetic foot. This module will cover the risk stratification of foot problems in a patient with diabetes. Case presentation. A male with diabetes presented to our medical ward with chest pain and was diagnosed as having non-STEMI. You can see that he had a below-knee amputation on the left side. Right foot also has poor pulses, deformities, and neuropathy. Already there is an ulcer as shown in the picture. He has never smoked and there are no other risk factors. Can you guess his age? He is only 38 years. He had been having diabetes mellitus from 15 years. You can understand the impact these foot problems have caused to this young male. Ulceration and amputation are the end results of multiple insults that occur to the feet of a patient with diabetes. Usually, peripheral arterial disease, loss of protective sensation, and deformities are seen in these patients before they develop foot ulcers and require amputation. Therefore, if we detect these problems early enough, we have time to intervene and protect the feet, lives, and quality of life of our patients. If a patient develops a diabetic foot ulcer which recovers completely, the story does not end there. The risk of recurrence is 65% within the next 3 years. Therefore, we have to identify these high-risk patients to prevent them getting another ulcer leading to amputation. With that background, you will learn about risk stratification in this module. We will answer few questions starting from understanding what risk stratification is. Then you will learn about the objectives of risk stratification, method of risk stratification, and measures to be taken following risk stratification. At the end, you will be able to learn how to apply this knowledge to a patient with diabetes, followed by few key points to remember. First, we have to know what this term means. If a patient has an active ulcer at the moment, we are not going to talk about risk of diabetic foot ulcer. But in a patient who has no diabetic foot ulcers at the moment, we want to know the risk of developing diabetic foot ulcer. In risk stratification, using history and examination, we try to predict the risk of developing an ulcer in a patient with diabetes. With that background, you will learn about risk stratification in this module. We will answer a few questions starting from understanding what risk stratification is. Then you will learn about the objectives of risk stratification, method of risk stratification, and measures to be taken following risk stratification. At the end, you will be able to apply this knowledge to a patient with diabetes, followed by few key points to remember. As we highlighted earlier, diabetic foot ulcer and amputation are associated with significant morbidity and mortality for the patient. Therefore, we have to use a comprehensive approach to prevent diabetic foot ulcers in our patients with diabetes. In doing so, identifying the risk of foot problems is a key element which will provide the foundation for other measures. We routinely use the risk category of the patient to define need for specialized care, to individualize patient education, apply specific corrective measures, and to decide on frequency of follow-up. For example, if you detect a high-risk patient in a peripheral center, it is advisable to refer him or her to a specialized center. Similarly, education we provide for all the patients will be modified according to the risk of the patient. With that background, you will learn about risk stratification in this module. We will answer few questions starting from understanding what risk stratification is. Then you will learn about the objectives of risk stratification, method of risk stratification, and measures to be taken following risk stratification. At the end, you will be able to learn how to apply this knowledge to a patient with diabetes, followed by few key points to remember. Detailed foot assessment is the cornerstone to an accurate risk stratification. As discussed in detail during the previous module, foot assessment has to be performed at least annually in a patient with diabetes. During the assessment, history should focus on previous foot ulceration, amputation, being on RRT, and symptoms of foot disease. The goal of foot examination is to identify three main precedents of ulceration: vascular disease, loss of protective sensation, and deformities. This is the foot assessment form developed by SLDCI to help the process of risk stratification. When you have a closer look at section B, you can see it covers the three examination components: deformity, LOPS, and vasculopathy. Then it has a section on history that indicates high risk of diabetic foot ulcers. Here you have to recognize that end-stage renal disease alone will put a patient with diabetes at high risk of diabetic foot ulcers and amputations. As shown in this table, based on the foot assessment risk of diabetic foot ulcers can be categorized as low risk, moderate risk, and high risk. There is no group with no risk. Any patient with diabetes has some risk of developing diabetic foot ulcers. In addition, as shown in the last row, there might be some people with active foot problems. If there is an ulcer spreading infection, critical limb ischemia, gangrene, or suspicion of acute Charcot arthropathy, they are having an active foot problem needing urgent intervention. Critical limb ischemia is defined using several methods: presence of gangrene, rest pain, or ABPI less than 0.5 are commonly used criteria. In patients without active foot problems, we define the risk category as illustrated in the first three rows. If there is no PAD, LOPS, or deformities, the person is considered to be of low risk. If any one of them is present, they are considered to have moderate risk. In a patient with combination of any two from non-critical limb ischemia, LOPS, and deformity or callus risk is considered high. Additionally, previous ulceration, amputation, or RRT will automatically put the patient in the high-risk group. Now that you are aware of methods of risk stratification, we will see how this information can be used in patient management. Foot care approach to individual patient will depend on the risk category. Low-risk patient can be given basic foot care advices and instructions to use a comfortable and appropriate footwear. Since their risk can go up later with the development of new complications, they also should be reviewed annually for reassessment. Patients with moderate risk should be given additional education to emphasize need for foot care and appropriate footwear. They are best referred to a specialized foot care service or to specialists to correct underlying risk factors. For example, if there is peripheral vascular disease, they will need vascular surgical referral. Depending on deformities, they will need custom-made footwear. They should be reviewed more frequently. High-risk patients need careful follow-up with regular assessment. Foot care education should focus more on identifying foot problems, early to seek immediate medical advice. They need therapeutic footwear. They should be referred to specialized diabetic foot care services. We will now see how we can apply this knowledge to the patients we see in our practice. First example is on a 29-year-old male with type 1 diabetes mellitus. He has LOPS and there are no other abnormalities. Based on the presence of LOPS, without other risk factors, his risk of diabetic foot ulcers is moderate. Based on the risk category, he needs to be reviewed frequently to identify additional problems. He should receive detailed foot care education since there is LOPS. This includes foot inspection, cleaning feet, proper nail care, and early healthcare advice in case of any active foot problem. He needs appropriate footwear to prevent development of ulcers, calluses, and deformities. Depending on his lifestyle, we need to give individualized advices to prevent any harm to his feet. For example, depending on his occupation and for any sports and exercises. Moving on to the second patient. This is a 72-year-old female with multiple comorbidities. She has LOPS, calluses, and several deformities. Therefore, she is at high risk of diabetic foot ulcers as indicated here. She should be closely followed up to identify any active foot ulcer. Education should emphasize on high risks and measures to protect her feet. At this stage, involvement of a family member or a carer would be useful. She should be managed as a specialized foot clinic. She needs custom made therapeutic footwear to offload high pressure areas. In some settings, corrective surgeries are also considered. Coming back to our young patient, we will now understand that healthcare systems should be geared to prevent these complications in our patients. Ideally, systems should catch them before they develop any active foot problems using risk stratification discussed in this presentation. Even if that opportunity is missed, the risk to the remaining limb should be realized once he has undergone an amputation in one limb. This will help us to protect him losing the other limb. With that, we reach the end of this module. First key message is to remember that diabetic foot can take your patient's limb and even the life. This is not uncommon. Identifying the risk of diabetic foot ulcers and amputation is the cornerstone in preventing this from happening. Foot assessment is performed with intention of defining this risk. Once we risk stratify, we can use that information to plan the rest of foot care measures. Remembering these key messages will help you to protect your patient's feet in the future. Thank you.